With me, Vinod James. Welcome to Neethus Academy Reading Live. How are you all? Did you all enjoy your 2 days of rest? Did you? I'm sure that you all would have practiced as well, isn't it? I know you're all untiring students who keep on practicing. So hats off to each one of you because of your lovely effort. So just to add the cherry on top of your effort, we come in here with you just like these small classes on a daily basis. So I come with reading, Neethu madam comes with writing. There are n number of other things which is there. Ashley Jones, good afternoon. Softy, good afternoon. Yes. Right. So if you're unaware of what are the things that we do offer, we have an array of linguistic exams that we do. So if you are still unaware of, please do not hesitate to contact the number that is there. They'll be happy to assist you. Right, as you can see, Feb, March, April is our next admission, and that also is filling up so quickly. Right, so if you want to get some professional approach, do not hesitate to contact. They'll be happy to assist you. We have regular batches, we have crash courses, you name it, we have it. Thangasudha, good afternoon. Lisa Molmanoj, good afternoon. Sonia Beeman, good afternoon. Deepthi Niku, good afternoon. You name. So is there anybody who's attending the live for the first time? Please do let me know. Just to add on to my notes people's list. I'd love to say that I have people across the globe. That's all. Uttam Kumar, good afternoon. So if you have not yet liked our page, please do click the like button. If you have not yet clicked the follow button, please do click the follow button. If you have not clicked the subscribe button, please do click the subscribe button. No matter whatever that you're watching, please do show that you're there to support us. Ramya Gopi, good afternoon. Thank you for the bouquet. Saumyana, good afternoon. Bhuvaneshwari, good afternoon. Athiras Sally, good afternoon. So I'd love to see all those icons next to your name. If you have not yet, please do show the support because it's because of you that we are here. All right, so please do show that support. And the only request I ask for is just to share the very same link that you're watching on your social media platform, because there are n number of students who are still unaware that we are giving these free classes. If you could, that will be of great help to others as well as, of course, for us on the aspect, because we can reach for all those needy. Anu Appus, good afternoon. Anu Anna and Jose, good afternoon. So no matter wherever you are, whichever part of the world you are or part of the world you're from, a good morning, a good afternoon, and a good evening to all my lovely students. Excellent. One small request, is there anybody who's attending the live for the very first time? Angana Ringlondo, who's attending the live for the first time? Yes, Angana Ringlondo. If so, please do let me know that you're attending the live for the first time, and also if you could, where are you from? All of you have been here or before also. Okay. Fair enough. As I mentioned, Neethu madam will come in front of you with, every time she comes up with a new writing case note. So self-prepared, do not miss that opportunity. Priya Chiku, good afternoon. Blessings Korea, good afternoon. Nice to see all those, at least one icon next to your name. Yeah. Right. Now I was just asking, how was your weekend? Tell me, what did you do on your weekend? Quite eager to know. What did you do this weekend? Beena Binu, good afternoon. Reshma Sajid, good afternoon. Lot of new names. Sophia Jitin, good afternoon. Lisa Mole. Waiting, 15, 12. Do not worry. You will all be there, and we all will be waiting for you there. Soni Raju, good afternoon. Nimi George, how am I? I'm doing excellent because you are all there to support us. So what else could we ask for, isn't it? Softy only studying because December 16th happened. Do not worry, Softy. Our prayers are always there, and your hard work, of course, nothing to replace it. Because of your hard work, do not worry, you will be there having a lovely exam. And I'm sure that you'll have your required score. Sri Lakshmi Lechu, good afternoon. Shakila Banu Saudi, good afternoon. Bless his career, studying, preparing for exam. Okay, I love to hear that you're all so enthusiastic there. No matter whatever that you have done. All those things, the good deeds, the good practice that you've done will take you through. Yeah. Princey Jomon, good afternoon. Softy, thank you. Pleasure. Soumya Joseph, good afternoon. Right, so all of you are right in the words on the day of exam. So do not worry. Our prayers are always there for each one of you. Okay. And of course, your hard work will definitely pay. Of course, God will grant you to have a lovely exam. Ashpati, good afternoon. We have just pinned the official Neethus Academy Telegram pages as well as the latest edition of WhatsApp channel. If you have not yet followed, please do join that, and these are all free access for you. Annie Davis here, nice. How is the weather there? Lenny Kurian, good afternoon. Nisha Libin, good afternoon. Lisa Anson, good afternoon. Tina Antoni, good afternoon. Anita Prabhu, good afternoon. Siji Jimmy, good day. Same, good day to you. Excellent. I hope all of you are eagerly waiting for today's session. Yes. So I couldn't see that anybody telling me that you're new, so you know what and how things would go. Resna Suraj, good afternoon. So we'll be talking about two things. Binu Yohanan, good afternoon. One, we'll be discussing a part B, and the other one is a part A, which I've already shared. Renita Joan, good afternoon. Right. So we'll be talking about part B. That's the first thing that we'll be doing. The part B question will be popping up on the screen. As soon as the question pops up, do not waste your lovely time. Just do it. And for all those students who have the exam, do find the answer on or before time. Softy AS, Shruti, good afternoon. Nimijo, the way of speaking of yours is stunning. Thank you very much, Nimi. It's all because of you all, because your teaching has enabled me to come up, because I do practice on a daily basis why I speak. Simple way. There you have the question. Please do the material and then we will discuss. Okay. I've missed a lot of good afternoon. Okay, I'm very sorry. Nisha Jose, good afternoon. Renita Reddy, Sainab Ramaya, good afternoon. Kalamani Shankar, good afternoon. Aksha Sabu, good afternoon. Sujata K, good afternoon. Anshu Varghese, good afternoon. Shakila Banudan. Georgina George, am I happy to hear that? I passed reading because of you. Georgina, please do not take anything away from you. It is your hard work. If you have cleared, if you've made to that lovely score of yours, it is all because of you and your hard work. Don't take anything. I'm just only a small bridge between you and your dream, isn't it? I have pushed you to the extreme and you have survived. And that's what gives that. So Georgina, very, very happy to hear that you've made to your dream. May I know what is your score so that it becomes a catalyst to all my other students who are here in front of me, so that they will also have that aspiration, saying that, okay, I'll also come and say one day that I have made to my dream. So congratulations, Georgina, on your great, great, great thing which has happened onto your life. So happy. So congrats, Georgina. All the very best for your future, for your journey, for your dream life. My prayers are always there, going to be with you. Softy done, Blessy done, Sophia C, Bincy C, Sony Raju done, Tinu Joseph done, Sheenu, good afternoon, Lini Kurian done, Selva the Heartman. And okay, all of you are saying C, Deepti C, done. Excellent. So all those lovely people who have given me the answer, please be kind enough to tell me where you got that answer from. Okay, it doesn't matter whether all the people have said one answer. Whatever is your answer, do tell me, because my job as a trainer is to correct you from where you went wrong. Soumya Joseph C from last sentence of first paragraph. Okay, fair enough. Good enough. How about others? Sony, Raju, C, Lord Nisha, Nimmi, all of you have said C. I want all of you to tell me what is your answer and where you got that answer from. That where is important, because that's how I believe. Because I believe in coming and correcting if needed. Okay, from where you went wrong. C from the first and the last part. Akila Banu, C from the whole para. Blessis Karia, eliminate two. Very good. Lini Kurian, C from last part. Tina Antoni, C. Renita, C. Kalamani Shankar, B. Binu Yohanan, C. Okay, now I have B and C. Good enough. Selva done. Sophia Jitin, I got only by eliminating. Fair enough, Sophia. Sony Raju, C from the whole para. Fair enough. Saumiana, C from the last part. Selva Kumar, okay. Georgina, all these congratulations are for you, okay? Selva is saying congrats. Rasna Suraj, C from last sentence. Uttam Kumar, C. First 3 lines, okay. Very good of explanation, detail. Sujata, C. Good enough. So this is how we as a family work, isn't it? No matter one of our family member gets that lovely dream of that score, all of us are very happy and all our prayers are always there with you. Right. Sign up. Thank you so much for all. Very nice. For all your guidance and support. I cleared November 11 because of Neethus. Okay, absolutely. Sign up, Ramaya. Again, thank you so much for giving whatever that smallest thing of your effort to us also, because we always believe that it is your hard work that pays. So Georgina, sign up, all have come and given that or made this week a lovely week, because the first good thing to happen. Georgina, thank you. 317 reading, absolutely good enough, Georgina. Keep it up. Very, very, very good. So happy for you. Siji Jimmy also saying B. Nimi George, first para. Right. Now, as we have said, it can be either B or C. Now let's see whether it is B or C. Okay. Kavita C. Okay. See, first and the foremost important thing about doing part B is you're not gonna softy congratulations. Take Georgina, sign up, all these are for you. All our family members are happy. So when you're doing a part B, the first and the foremost important thing is to read the question. And as you read the question, underline the keywords in the question. And I've always forced my student not to draw anything more than 2 or 3 words. There's a purpose, because you have to, your keywords are the words that where your eyes fall upon. Okay, if you write big sentences as keyword, it's not going to be of any benefit to you. That's the reason why you're being pushed. Now let's see what are the keywords in here. So the guidelines on pediatric procedural sedation suggest. So guidelines suggest. Those are my keywords. So understood, isn't it? That pediatric procedural sedation is the whole topic about. So you really don't have to worry about it. So they're talking about what is it? Whole thing suggesting. Network issues for me there. Sorry. No worries with me. I can understand. Now after that, you have 2 options. One, you can read the answer option. If you're like me, underline the keywords in the answer option, then pick it up from the paragraph. Or if you want to read a paragraph and then pick an answer, either way is fine. Whatever that is your way, stick to it. Okay, my way. So patients who are sick should not receive sedation. So very simple, sick, not receive. So sedation is understood. Yeah. Now, sedation is likely to be more difficult elderly. So understood. The approach to sedation changes depending on patients. So approach depends on patient. After this, you're going to go to the paragraph. So don't skip any of this. Pediatric procedural sedation. So clinicians who administer procedural sedation to patients must have a thorough understanding of the actions of medication being administered, including modification for age, concurrent drug therapy, and disease processes. So very simply saying, people should know what it is. Okay? So it's slightly, because I always believe the first sentence as far as it's concerned is giving me a slight clue saying that it can be C. Let's see. Knowledge of the correct procedures is also required for safe administration of sedation. So yes, they need knowledge also. Then, patient selection is a major factor in achieving safe and successful procedural sedation. The approaches described in this guide are intended for use with patients who generally have healthy or have only mild systemic. So again, it is talking about depending on the patient. So more severely ill patients, those with complex medical problems, or infants and under 12 months of age or less than 10 kilograms should not be sedated outside the operating theatre. Now see, sedation is more likely to be difficult in elderly patient. Is it saying elderly patient? As far as I can see, there is nothing mentioned, but let's see. People who are sick should not receive. No, they are not saying like that. People who are more severely ill should not be sedated outside operating theatre. It's not that they shouldn't be treated. So A is a straight eliminator. Children who are very anxious prior to procedure need special consideration and may be more suitable for general anesthesia in operating theatre. So nothing mentioned about elderly as well. So this eliminated, not received. Those are the 2 which can be easily eliminated. So the approach is where the answer is. So the answer is C. So congratulations for all the lovely students who have got C. Congratulations to all the students who have got B. Because elderly, where is it talking about elderly now? Is there anywhere talking anything about an elderly person point of view? Soni Raju, keep on dancing. Why not, isn't it? You should always enjoy your success. Bless his career dancing. Keep it up, keep it up. Good, good, good. Anywhere mention anything about elderly patient? Tell me. Softy is happy. Good enough. Selva Kumar is all with love. Good, good, good. Tangasudha, thanks. Pleasure. Uttam Kumar, balle balle. Is that? Okay, good enough. Soumya Joseph dancing. Good. Binu Yohanan, happy. Any doubts with the things that I've told you? Tangasudha is always thanking. Okay, fair enough. Prashna Suraj is happy. Anybody have any doubts with regards to my explanation? Nimmi George is so happy that she's dancing. Siji Jumi is saying, see, okay, fair enough. Soumya Thomas is happy. Right. Atira Sally is happy. Good enough, good enough. So anybody with any doubts? Sophia Jitan is so happy. Any doubts? And as you can see, that Neethu madam is going to come 15th of this month. on the very same page that you're watching. Do not forget, keep a timer, set an alarm, and do not miss. Kavita Balaji is dancing. Good enough, good enough. So, as you all are having no doubt, let's go into the next one. What is today's material? And please do let me know how you felt about today's material. That how is very important. Tell me what is today's material and how you felt about it. Let me see what are your insights, because after seeing this menopause, easy material, softy, okay, the first thing I have is easy, Soumya Joseph easy, okay. So all of you are saying easy material, okay, fair enough, fair enough. Right, I want all of you to comment. Do not hesitate. See, whatever you feel, you are always happy. You should be happy to comment. If you feel whatever. Easy Tanga, okay, fair enough. Uttam Kumar, easy. Good enough, good enough. So generally, the first few I have got is easy. Anshu Roy is saying good afternoon and easy material. Okay, fair enough. Kavita Balaji, easy. Lini Kurian, easy. Alright, so generally it's all easy. Nice material, Okay, fair enough. Easy materials only. Alright. Tina Antone, good one. Okay, fair enough. Anita Prabhu, easy. Clarina Fernandez. Easy. Kalamani, easy. Lisa, material, okay, alright. Fair enough. So I generally have a general base or general idea about how you felt, but the more you comment, that's how we have a gauge about how you felt about our material. Alright. So we'll be happy to see more comment, because Neethu Madam will be looking at your comments, so she would also get a gauge of how the materials are by looking at what you have commented. Right, and as you have said, it is going to be menopause. Sijijimino, what do you mean by no miss? You didn't do the material. If you have not yet done the material, no problem. You are always welcome to do the material and then see the answers, or else that material is a waste. So that's why even in class I don't allow students without material. Okay. So the material will be popping up on the screen. I hope all of you have done. If not, do the material and then see the answers. That's what the Ashok is saying, easy material. Okay, there you have the material. Now to tell you how are you going to tackle. See, part A is a material which will be given first on the day of exam, where you will be having 15 minutes only, where you have to tackle 20 questions. This is something which you have to be very cautious about. So you need an appropriate strategy. So the strategy in here is called skimming and scanning. So what is skimming? What is scanning? Skimming means quick look. Scanning means detailed look. So in this quick look time, what are you to do? You're going to underline the keywords. So what are the keywords that you have to underline? How you have to underline? We have given an in-depth analysis on the very same page that you're watching. This after the live, go back, and it takes a bit back. You can always refer to it. So keywords, you will have 4 different texts based on one common theme. So here the common theme is menopause. Text A, you are supposed to take 15 seconds to skim. Although they say 1 to 2 minutes, I say 15 seconds. You should be able to skim through. So skimming means quick look. You're not going to read each and every word. You're going to quick read it, and as you read, you're going to underline the keywords. I'll just show you. See, menopause is a point of time in which we have 12 consecutive months of the menstrual period. Menopause is a natural part of the aging and not the end of the reproductive, on an average of age 51. Time leading to menopause is called perimenopause, in which a lot of women PSS A, B, and the transition to menopause, and menopause is the menstrual age or symptoms. So symptoms. Stages happen in 3 stages: perimenopause and menopause transition. But 10 years, menopause is the point where you're in menstrual period. At this stage, your ovaries have stopped releasing eggs and stop producing most of the estrogen. Postmenopause is in time where you had in the entire year. So these are, so text A is about what is menopause, what are the 3 stages. Text B, you may be in transition into the menopause if you experience some of all these following symptoms. Again, they're going to give a lot of symptoms. So anything about symptoms, please look into text B. Now going into text C. So these are the contraindications of menopausal hormone therapy. So anything, contraindication means adverse effect. So anything on the aspect of effect contraindicated, go to text D. Sorry, text C. Text D is about complications. So complications, you're gonna look into that as well. So any aspect of complication, go to Text B. Text D. So they are talking about all this. After this, you're going to underline the keywords in the question as well. See, 20 questions. It is divided into 3 types. You should by heart this. So 3 types of questions, 20 questions are, what are those? So 1 to 7, these type of questions are called match the following questions. You should by heart this. 1 to 7, match the following question, where the instruction clearly says it can be anything between A, B, C or D. Any of these letters can be written, and you may use any of these letters more than once, because 1 to 7 questions. After this, you're going to do the very same thing. You're going to underline the keywords in the question and then refer. Part A is about keyword reference, so your keyword reference is very, very, very important. That's why we keep on reminding, please underline the keywords. Now see, I'll tell you why keywords. If a keyword is proper, your answer to what, part A is just a piece of cake. Now I'll show you. What physical, so keywords are physical and mental changes do women encounter during menopause? So where are they talking about during menopause? It should be there during the symptoms, isn't it? You may be in transition of menopause and then begins with experiencing some of the hot flashes and all those. Worsening bone menstrual, some duration. So all these symptoms are mentioned in. So the answer is B. What factors restrain someone from receiving menopausal hormone therapy? So something about hormonal therapy, go to C, isn't it? There is no second thought about it. Why? Because it clearly says these are the substances where the risk of fractures and all those things are mentioned. Understood? So all those keywords are as such mentioned in this, because absolute contraindications, so all these contraindications are all mentioned there. Now, which condition leads to weakened bones and increased fracture risk? So that is the next question. So the next question, of course, complication, brittle bones, weak, leading to increased risk of fracture. A very straight answer. So the answer is D. Now, what medical conditions act as a contraindication for menopause treatment? So, medical condition, contraindication. So, where are they talking about? Definitely C, isn't it? What are the medical conditions? All those medical conditions are mentioned in text C. So, the answer is, so this is why keyword. You have to always refer with the keyword. Now, what increases the risk of cardiovascular disease in experiencing menopause? So, cardiovascular disease, experiencing menopause, where are they talking about? So it should be also there in D somewhere, isn't it? Why? Heart and this cardiovascular. So what is that? Estrogen levels and all those cardiovascular diseases increase. So the answer is D. Understood by keywords? Different phases of menopause. Do you really need a second thought? There are 3 phases: peri, meno, and post. A, I'm not even looking because I could. This is how you manage time if your skimming is proper. When does one transition into post-menopause phase? So the period, again, it's there in A, isn't it? Post-menopause, it's after the entire year. That's called post-menopause. Now the next set of questions, these set of questions are called short answer question, where your answer can be a word, short phrase, anything between 2 to 3 words, or number or numbers or both. That means word or phrase. Even though the type of question changes, the strategy doesn't change. You're going to underline the keyword and refer with that. So what condition is characterized by frequent urge to urinate following an involuntary loss of urine? So definitely they're going to talk about all those things in where? Complication, isn't it? So urinary incontinence and tissue of the vagina and the urethra loses elasticity, and you may experience frequent, sudden, strong urges to urinate and followed by an involuntary loss of urine. All those keywords are as such. So I can see that all of you are typing 7 out of 7. Ansu, Soumya, Softy, absolutely good enough. Keep it up, Selva 7. Good, good, good. So happy to see that all of you are getting great scores. Kalamani 7. Good. Kavita 7. Good, good, good. Akila 7. Excellent. Nisha 7. Very good. Tony 7. All right. Good enough, good enough. Right. Now let's go into the next question. The unrecognized medical factor. So something which is not recognized. Okay. So unrecognized medical factor that could pose a contraindication to hormonal therapy. So definitely they're going to talk about hormonal therapy. Something is going to have. So what is that they're going to talk about? Okay. So what are they talking about? They're going to talk about something in C, right? The undiagnosed, that's where, what is the problem? Genital bleeding. So the answer is GENITALBLEEDING. So all those people who have said 7 out of 7 and 6, absolutely good enough. Keep it up. Now, next question. What is a term for the sudden warmth that spreads over the body signaling menopause? So sudden thing which causes, definitely in B, isn't it? What is that? Hot flashes are also known as vasomotor symptom, a sudden feeling of warmth that spreads over your body. So it can be either hot flashes or you can also say vasomotor symptom. But the safest or the best option is hot flashes. Okay? Right. Either one is fine, yeah? Lower levels of which hormone increases heart disease risk to menopausal individuals? So definitely, what is that? Which one are you talking about? Isn't it a very straight answer? The answer is estrogen. Estrogen is clearly meant your estrogen level declines. So ESTROGEN, the answer. Which disorder serves as a complete contraindication for menopausal hormone therapy? So something which is a complete contraindicated. So what is that? Absolute contraindication. Which one? Porphyria cutanea tarda. So PORPHYRIA CUTANEA TARDA. 3-word answer. Now next. Okay, it just went, isn't it? Potential condition, okay, which might be anticipated when discomfort is felt during sexual intercourse. So something, what does it cause during sexual intercourse? Well, where are they talking about it? So that should be there in B, isn't it? So what is the problem that is during the intercourse with they are saying? See, vaginal dryness that causes discomfort during sex. So the answer is vaginal dryness. VAGINALDRYNESS. So what is the mean age range of women to undergo menopausal transition? So mean age, mean is a word which says average. So average age is mentioned as what? It is mentioned as 51. So the answer is 51. Clear? Good enough. Now for the next set of questions. The next set of questions are called, the final one are called fill in the blanks question, where the answer options remain the same, very similar to short answer question, but here redundancy. Please ensure that you are not repeating even a single article which is there, already there in the question, then do not write. Soumya, 10 years is wrong, 51. Now, dash or variations in menstrual flow are indicative symptoms of the onset of menopause. So where are they talking about? It should be there somewhere in complications, isn't it? So irregular periods or periods that are heavier or lighter than usual. So irregular periods that are variation in menstrual, that is why irregular. So irregular periods or variation in menstrual flow are the indicative symptoms. Good enough. Dash results in bones becoming brittle, weak, elevating the susceptibility to fractures. So something is going to cause you the susceptibility. So where are they going to talk about the susceptibility of fractures? Osteoporosis. OSTEOPOROSIS. Okay, that is why it increases the risk to fracture. Menopausal hormone therapy is contraindicated for individuals with current, past, and suspected what? So they are also talking about something in there. It says if you have current, past, or suspected breast cancer. The 2-word answer, BREASTCANCER. Menopause is officially recognized when person experiences dash consecutive months without menstrual. So it's definitely 12, isn't it? Where do you get that? Straight. The very first sentence, 12 consecutive. Good enough. The onset, that means onset is a very, very prominent word which comes in, especially in part C and all. Onset means beginning. That's why whenever we do a material, we get you exposed to a lot of different terminology. So please always look into the terminologies that is being part. That is for you to get exposed to that. Okay, so find the meaning if you don't know. Yeah. It can commence 8 to 10 years prior to menopause, characterized by gradual reduction in estrogen production by the ovaries. So where are they talking about all these? Again, it should be there in A, isn't it? Perimenopause can begin at 8 to 10 years before the menopause. Ovaries gradually produce less estrogen. PERIMENOPAUSE. The ultimate question for today. The diminished dash of vagina, the urethra tissue, results in sudden and frequent urge to urinate. We have already gone talking about it. So they're telling, what is it? The sudden loss of elasticity. ELASTICITY. So I have completed, or I have fired my 20 answers. Almost all of you have got it right. So if you have any doubts with regards to any of the questions, please do clarify. If not, do shoot me your total scores. Eagerly waiting to see how many have got all scores. Softly 20, absolutely good enough. Keep it up, keep it up. So the first one to say 20 out of 20. Very, very good. Selva 19. Thank you for getting all those scores. Tina and Tony 17. Very good. Keep it up. Guy 320. Lovely. Keep it up, keep it up. Soni Raju 20. Lovely. Keep it up. Lisa Anson 18. Good enough, good enough. Keep it up. Rashna Sood is lovely. 20 out of 20. Good, good, good. Akila Sham 20 out of 20. Lovely. Keep it up, keep it up. Sini Korean 20, absolutely good enough, stunning, keep it up. Saumya 16, good enough, good enough. Saumya understood where you're going wrong, just go back and see where you have missed and how you have missed, yeah? You will be there, no worries. Ramya Harish 19, keep it up. Atira 18, Anshu Roy 20, good enough, keep it up. Atira Prabhu 18, Nivedya 18, Trupti 15, okay, 15 answer, irregular periods. You just refer the other keywords. Higher and lighter are given as the paraphrased option. Yeah. Kalamani 18, good enough. Suti 17, Renita 18, Ashwati 20, absolutely good enough. Priya 18, Uttam Kumar 20, 13 minutes, absolutely good enough. Lovely, keep it up. Good, good, good. So you're all there on the higher level. People have missed. Do not worry, you are here to learn. Okay? So we are there to assist you no matter what. Okay, but you have to make sure that you're coming out of that comfort zone. Okay, Tripti is saying thank you. Good enough. Softy is saying thank you. Fair enough, fair enough. Tripti 18, good enough. So as we have all started to say thank you, is there any general doubts that you want me to clarify? Uttam Kumar is saying thank you. Good enough. Good, good, good. Right, Kavita Balaji is saying thank you. Shruti, thank you. All right, so Georgina and I missed another person's name. Sign up. Congratulations once again. Thank you so much for coming and letting us know this lovely news of yours. A great thing that has happened in your life. We are very happy for you. So until and unless I see you all tomorrow, adios from me. God bless you all. Take care. Bye.